Hello, everyone, and welcome to our Community Catalyst podcast with the YMCA of Greater Nashua. I am Lynn Boyer, Executive Director of Community Impact, and my guest today is Dr. Cynthia Whitaker from Greater Nashua Mental Health. Welcome, Cynthia. If you'd like to share a little bit about yourself, please do so.
Great, thank you. Yes, I'm Cynthia. I am by training a licensed psychologist, and I've worked at Greater Nashua Mental Health for about 17 and a half years now. I started here specifically from other community mental health centers because we have a deaf services program, and I'm also fluent in American Sign Language. So helped regrow that program, and then took on bigger and bigger roles and bigger programs, and became the CEO 3.5 years ago.
Great, thank you. So we're here to talk today about our partnership. This podcast serves as a way to highlight our community partners, agencies that we work with in the community to impact the Greater Nashua region as a collaborative effort. So first, can you share what your organization does, where it's located, and who it serves?
Yeah, sure. So what some folks don't know is we've been around for over 100 years, and I understand that's almost true of the Y too. You're celebrating your 100 years this year. For us, we're about 104 this year. But we've always been community focused. We actually were part of setting up the library here in the city, and some of the social services that became Southern New Hampshire Services started at what was then called the Community Council of Nashua. But in the 60s, really focused on becoming a community mental health center, and have been one really ever since. And what that means is we serve a wide variety of people, really from birth. We have programs for new parents to interrupt intergenerational trauma, all the way to specialty programs for older adults, getting specific treatment for that time of life, and that are, specific to mental health, that are specific to substance use, that include wraparound services as well. And we have multiple buildings throughout Nashua. People often think of us as, the building across from the hospital on Prospect Street, but we have 2 on Prospect Street, Pine Street, Amherst Street. We're all over the place. And we do serve Nashua and 9 surrounding towns as our designated region from the state. But we do have some programs that people can come to us from anywhere in New Hampshire, and that's like our substance use program and our deaf services program.
That's great. It sounds like you guys have a lot to offer and a vast, diverse population that you serve as well. I know that since COVID, there's been an increased shortage of mental health workers as well as accessibility. Have you found that at your agency? Do you have a wait list for some of the services, or do you find that you're able to effectively serve most of the people in the community?
Yeah, it's such a great question, because there was actually a mental health care shortage for workforce before the pandemic. Looking back at some of our old emails and what we were advocating for, like in 2018, 2019, that then just got exacerbated by the pandemic and people shifting their idea of work and what work could look like. And then, of course, people needing more services because of the isolation and challenges that COVID brought. We were able to keep our open access time open all throughout the pandemic. We had to close it for a little bit of time while we figured out how to do it via telehealth, but we've never stopped taking in clients. Now, that means somebody comes to us whenever they're ready, Monday through Thursday in the morning. We're open, we assess people. And what we do is we help people figure out, are we actually the place for them? Are we not? And then we tell them, okay, if you need this treatment, there's actually maybe not a way, or, for kids to get in, it's about this. For adults, it's about this. And we talk to them about what we might have available to them while they're waiting, which could be actually services they need, such as working with people on other social determinants or social drivers of health while they're waiting, maybe to see a therapist or someone else.
Right. Great. Thank you. So I know we've collaborated in many different ways over many different years, but what are some of the partnerships that your agency has had with the Y recently that you'd like to share with us?
Yeah, I mean, like you say, we have a long history. I mean, the Y has a long history of really wanting to make your services accessible to lots of people, and that's included some of our folks. So, we've had memberships for our clients, for our families, things like that. We have a special program that we call health mentoring or in shape, where we have folks that support individuals in accessing better health and health behaviors. And so as they support some of those clients at the Y directly. More recently, the Y setting up the Wellbeing Center. We were so thrilled to be, part of that opening and support all of that. But I think the most exciting has been the recent summers where we've been able to come back in and support at Camp Sargent. Now, like it's something we did long time ago. I don't know how we got paid to do it then
Mhm.
or what that looked like. I don't think I was here because I think it's been quite some time. But in 2021, the Department of Education um, created a grant called Rekindling Curiosity. And through that, the intention was to support children as they re-entered back into the world kind of post-COVID. And that summer, 2021 was a big time for a lot of kids. They'd been remote, and here they are coming back to camp. And so we were able to put some of our staff into Camp Sargent and a couple of other camps and childcare centers to help because of that funding. Um, but our staff were able to ahead of camp be part of training counselors and then to be on site providing face-to-face one-on-one hours also for campers themselves if they were kind of experiencing big feelings, et cetera, et cetera. And it was so successful that first season the grant continued for another season and another season. And so we are looking forward to being back there again with you this summer.
Yeah, that's great. And we're so excited to have you. I was sharing with Cynthia before recording that, I started my Y career many years ago when I was a college graduate. It was actually the story last week in Wednesday Wonder. But I was 22 years old, never worked with kids. I knew theater, that was it. And so having the community council case managers on site to support not just their clients, but the overall population was it was extremely helpful. And just in addition to that, my husband was one of the counselors, and so that's how we met. So that was a nice, aside. But
Yeah,
no,
one of the
it's
cool
great.
things too is, I didn't really realize the significance of the impact until really hearing Mike LaChance talk about that us being there over the summer was one of the first summers in history they hadn't had to let ask kids to leave because of
Mhm.
behavior problems, or where they didn't have staff leave because of feeling overwhelmed. And
Mm.
so just how important having that resource was on decreasing the demand on both kids and staff so they're able to be less stressed and enjoy summer and camp more.
Yeah, absolutely. Absolutely. I mean, camp is it's not easy. It's a very long day. And I always used to tell my staff, if you're not exhausted by the end of the day, you're not doing your job right. Because it's hard. And it's, as you know, staying on top of behavior and managing groups it takes a lot of engagement and a lot of effort. And I think it's great that you're able to have the support of that staff, even if they can give them a break or whatever it may be, but or even tools, right? To just
Mhm.
how to do their job effectively. It's really great. I think it's a great partnership. Camp is very near and dear to my heart. And so I think it's a great way that we effectively partner together. So wonderful. I'm so glad to hear that we're doing it again this summer. That's
We sure
amazing.
are. Yeah, we're so
Yeah.
excited.
Yeah, that's great. So what's something exciting that your organization has coming up? Doesn't have to be, Y related. It can be anything that, impacts the community.
Well, we are hosting, I don't know if it's our first ever, but it's our first in recent decades anyway. a 5K, 1K walk slash run slash, fun, whatever, be outside and be healthy, time, on Saturday, May 18th. Starting out at Greeley Park, and folks can, go onto our website, gnmhc.org, to learn more, to register, or call us over here if people want to help and volunteer. We'd love to have people that, are supporters of healthy behavior,
Yeah, that's
join us,
great.
sure.
Excellent.
So that's one big thing we have going on.
Great. That's good to hear. What are you most proud of as far as accomplishments in your time with the agency?
Well, I would say one big one was actually remaining open for clients that, we mentioned already during the pandemic. I mean, a lot of places just closed their doors and focused on whoever they were serving, and didn't take new folks. We even set up new programs to help, like, healthcare workers
Mm.
access mental health care during the pandemic because of the specific things they were going through. So I'm just so proud of that. Our real push toward collaboration, has really been something that I'm excited we're doing a lot more of again. I think, our history is of being the community mental health center, right? So it sort of premises we're in the community and collaborating with other community partners. But, due to funding and mental health stigma, and that hasn't always been consistent and easy for us.
Oh,
But we've really made a commitment. One of our pillars of our strategic direction is empowered community. And one of our values is collaboration, right? So just that, and what that means, right? It means partnerships like this. It means partnerships with Lamprey. They provide primary care on location for us. So just a lot of great stuff. And we are in the process of becoming what's called a federally designated certified community behavioral health center, or a CCBHC. Our history is, a state designated one. Now, we're not a state agency, but it just means we're designated by them. And to do that, we had to launch some new services. And so we've launched veteran services. It was a service I didn't realize how much of a gap there was. There are a lot of folks that do veteran services, but there's a lot of specific nuances to their programs, versus we were able to just do it broadly and widely, and we got to define it. So I'm really proud of that too. And I mean, and honestly, the biggest thing is just how tirelessly everybody works here
mhm.
for our mission. I mean, much like the staff at the Y, people here are just dedicated to helping people with mental illness live the best lives they can. So
Yeah, that's great. And I love what you shared about partnering too. I think sometimes, maybe not so much now, but as social service organizations or community organizations, we tend to want to do it all ourselves, but we can't, right?
yeah,
And so leaning on each other, working collaboratively with each other to bring in the strengths of the other agencies into our own, I think is really, really important. And in this role, I've really seen that happen a lot in the community and been a part of a lot of meetings and, summits, and where everyone is, we're so passionate, in this field, but also just recognizing that maybe we're not the strongest in this area, and what agency is, and let's build that relationship with them so we can partner. So that's great to
it's so
hear.
much more effective and,
Hmm.
better for the community as a whole when we do that. So
Yeah,
it's like, oh, we say we have the community at heart, or they're our mission, but then if we don't collaborate with our partners, we're actually not putting their
yeah,
interests first. So yeah, I
exactly.
couldn't agree more.
Yeah, exactly. Before we go, is there any one thing that you would want our audience to know about Greater Nashua Mental Health?
It surprises me, as somebody that's been here as long as I have and that's been involved in the community mental health system, how much people don't really understand about what we do. Like we're not simply another option to get therapy and medication. Yes, we have therapists. Yes, we have medication providers, but our core service is actually wraparound care for individuals. It's community-based care. It's addressing, social determinants, social drivers of health with evidence-based practices, right? Things that are researched and really working. So we have supported employment specialists, housing specialists, the health mentors I mentioned, and a lot of people don't really realize that about us. They think, oh, it's just another option for therapy and meds. And
Mhm.
really, we are so much more than that. And like I mentioned before, and we're not a state agency, right? And so we do follow state rules and we are state designated, but it means just like other nonprofits that are doing great work, like the Y, we provide, $1 million to 2 million this year of care that we don't get paid for.
Mm.
And so, we rely on people's support and help just like every other nonprofit. And I think people forget that because,
Mhm.
they think we're so connected. And we are in many ways, but we're just like everybody else in many others.
Yeah, absolutely. No, I think that's great. And I think, using your agency as a resource too. I know you have the Child Impact Program, which is an
Oh, yeah.
amazing program. And that's something for, people that may not even be facing any mental health challenges, just facing, divorce or a child custody arrangement change. So yeah, I agree with you so much more. Just like we say at the Y, we're so much more. It's hard to say everything we do in a quick podcast. So
Yeah, for sure.
definitely encourage our audience to check out their services. Like Dr. Whitaker said, go online, see what they have to offer. So thank you so much for being a guest on our Community Catalyst podcast. And thank you to our audience for watching and listening, and stay tuned next month for the next one. Have a great weekend. Bye-bye.